Hi everybody. My name is Fidelma and I'm a lecturer in physiotherapy at Ulster University. And today I want to take the opportunity to discuss with you one of our online modules. And online learning is a really flexible and effective way to study. You will need to be organised, connected, engaged, motivated. You will devise a schedule and then hopefully stick with it. So now I'm going to explain a little bit about this. It's a 30 credit point, level 7 master's level module, long-term conditions. And people with long-term conditions will need long-term support to minimise the impact and ensure treatment is effective and timely. We, as allied health professionals, will support the person to make informed decisions about their medical management. The aims of the module are twofold. We want to support you to develop your clinical reasoning skills so that you will be able to support the person with that long-term condition, and not only the person but their families and carers as well. And you're going to enhance your learning because you're going to work in partnership with the person, with your peers, so that you learn more about how to effectively manage long-term conditions, both from your own individual professional perspective, but also from the wider multidisciplinary team perspective. The 4 learning outcomes associated with this module are outlined here. And one of the aspects of this module is it's giving you an opportunity to look at the evidence base around different strategies and guidelines, and to work out what is the most appropriate for your patient population. You will need to be able to critically analyse the evidence, and at more than an undergrad level, so you're progressing, you're developing your skills further. And you're going to justify the different treatment options and strategies which you use for that person with their complex needs. You will develop your clinical reasoning skills, and you can refer to the International Classification of Functioning, Disability and Health. So that WHO perspective, where you're looking at impairment, about function or ability, and participation, and the different domains and outcome measures associated with that. And you're going to look at the different bodies which will work with people, so across the statutory, the private, the public, the voluntary sector, who all work with people living with a long-term condition. And we need to have that joined up thinking. We need to all have the same aim in mind when we're managing the different patient populations. So we've all got the same goal. This is an example of some of the content in the module, which will help you decide whether this is a module which you'd be interested in finding out more about. And we have experts from our professional networks who talk to each of the different topics within the module. And we also have service user involvement. So they also help to inform us and teach us. So if you think, for example, one of the service users talks about using the Bridges self-management strategy. So that is a useful tool. If you consider the management of mental health, for example, you will discuss the patient management, and you'll translate evidence from the lecture and apply it to different clinical practice scenarios. Obviously, a very topical one for now is rehab of people with long COVID. So you will investigate, how we advise people in the rehab setting about pacing, about the chronic fatigue syndrome, and looking at the literature which is now becoming available to us to help us inform our management strategies. With regards to dementia management, very important that the multidisciplinary role, that holistic approach to patient care, and optimizing communication strategies. So that would be something to explore in more detail. People, for example, living with cancer. You've got a lot around prehabilitation and partnership working. Technology and telehealth, we feel that we have done a lot of that recently. And again, consider the important aspects when planning an effective service. And maybe we had to get a lot of services online very quickly, and now we're looking at the evidence to support the delivery of those services and how we can improve upon them, and whether this is a way forward for some aspects of our patient management. As I said, there will be experts coming in and service users who will populate the audio PowerPoints, and there will be a different topic every week. So it will be important that you do stay focused and stay involved with the week by week teaching. So you'll have an opportunity at the start of the week to learn a little bit about the content of the topic. And then as the week progresses, we will anticipate that you will get involved in the interactive online discussions. And this is a very useful way of sharing your learning and learning from each other. So it's a very important aspect of the module, and it's like us talking out loud to each other. And if you come across evidence, different evidence which we've discussed, then you will add that so that you're helping your peers in their learning. We will have synchronous sessions spread throughout the semester, and these can be topics that you wish to discuss in more detail, or we can set the topics. So that can, depending on what the objectives of the cohort involved. And obviously, one of our skills as an allied health professional is reflection. So we will be looking at our reflection on an ongoing basis throughout the learning of this module. Assessment drives learning. I'm sure you've heard that phrase before. So the format for the assessment for this module is the discussion board. There will be marks, 10% of the module marks will be attributed to the discussion board. Because it's really important that you can contribute to that online forum, both in answering some of the questions that we pose, in sharing the knowledge that you have gained, your experiential learning, and then maybe taking the lead and taking the lead for a topic and being the person trying to facilitate others, engage others in learning for that week. And then the majority of the module mark will go towards a written assignment. And this is when you'll be given a case study, and then you will explore the different strategies used to effectively manage that patient or that. And you will also consider the evidence base, and rather than describe lots of different studies, you will need to critically analyze the studies. And so you're improving your critical thinking skills, and you're identifying the strength of the evidence on which you're then basing your treatment on. Rather than me said, I've taken some quotes from students over the previous cohorts and what they have said, how participating in this module has benefited their clinical practice. So one person talked about how they could learn from each other within the cohort, that progression of your critical thinking skills, so that from that undergraduate now to your postgraduate level, that novice to the expert in your area of practice, and thinking of that long-term management of a person. Using the knowledge that you gain to motivate and educate people to make lifestyle changes. And obviously somebody with a long-term condition, that's going to be on a day-to-day activity. And the opportunity to search for and critically analyse literature, justifying outcome measures to determine effective management. So you're developing your clinical practice. So those are some of the benefits which people that have previously taken the module have identified. So if you'd like to hear more about this module, then my contact details are here. f.moran, M-O-R-A-N, @ulster.ac.uk. And hopefully this has generated some interest among you, and that we'll see some of you enrolled in the module in the future. Thank you.